Do people with poor mental health need to smoke to release stress?
I am Dr. Debbie Robson. I'm a senior lecturer in tobacco harm reduction in the Nicotine Research Group, which is in the Addictions Department at King's College London. I'm also a mental health nurse, and my background is in teaching and research and clinical practice, mostly amongst people with mental health problems and people who experience substance use, and trying to help them reduce their harm from tobacco.
What I hear a lot is that smoking is actually really important to people with mental health problems because it provides them with a means of coping.
Well, I think there's lots of common beliefs about what tobacco smoking does, and that relationship people with mental health problems have with smoking. So, for example, there's a common belief that smoking tobacco helps you relax and you feel less stressed. And it's one of the main reasons that a lot of people who smoke don't want to give it up, particularly for people with existing mental health conditions. But some of the reality is smoking may well be making you a bit more anxious and depressed in the first place. So it's a bit of a kind of paradox that it helps people kind of cope. And one of those reasons is it's the kind of effect of inhaling several thousand chemicals from tobacco smoke that you get with every puff on a cigarette. And nicotine, which is probably the most well-known ingredient in tobacco that people know about, but also probably one of the most misunderstood ingredients in tobacco, that when you have a cigarette, nicotine reaches the brain really, really quickly, within a few seconds. And what that does is it causes a boost of dopamine. And as you know, dopamine is that feel-good chemical. It's also a teaching signal. It teaches kind of the brain to repeat what's just gone before. So in this case, have another puff on a cigarette. But what nicotine does as a drug, it doesn't stay in the body very long. It's got so when you put out your cigarette, your blood levels of nicotine start to fall. And some of the signs, if you're a regular smoker, some of the signs of your blood levels of nicotine falling is you feel a bit depressed, you feel anxious, you feel irritable, you can't concentrate. The way to relieve those feelings is to have another cigarette. And so what then happens, people who smoke, that then becomes that feeling of relief and relaxation and coping, then kind of gets misattributed to the cigarette, when in fact what you've done is you've just treated your withdrawal symptoms.
That's really interesting because sometimes quote or try and quote a study, a systematic review that I think came out of King's where you work, and I think the result is that quitting smoking was as effective as a course of SSRI antidepressants. Have I got that right?
You are. So the initial review, one of my colleagues here at King's was involved in it, and then it's just been updated, and people in Oxford and the Cochrane collaboration have recently updated that, and they found that stopping smoking actually improves your mental health. You feel less stressed, and it improves your psychological well-being. And the longer you stop smoking, the more improvement that you actually see. So stopping smoking, it's not only one of the best things you can do for your physical health, it's one of the best things you can do for your mental health.
A lot of people, me included, suffer from anxiety and depression sometimes, and I can see how quitting smoking would help there. But you deal with people with severe mental illness because you're actually based at the Maudsley, right? And is it still true, maybe not for people with severe mental illness, right?
It is true. So I work closely with people at the South London and Maudsley NHS Trust. So we've got a lot of experience of kind of working with people with the more severe mental health problems such as schizophrenia, bipolar, and psychosis. And we know that people with those conditions, their smoking rates are 3 times higher than people without those conditions. And even with depression and anxiety, smoking rates are double what you see compared to people without those conditions. So there's a really close relationship there. And it's not entirely clear whether smoking is an effect or a cause of mental health problems. I guess there's 3 broad areas of research that look at that. So the first area of kind of research looks at smoking as being somehow self-medicating for these conditions. Uh, the problem with that kind of theory or hypothesis is the more you smoke, the worse your mental health is. So the more severe your symptoms of psychosis or depression are. So it's not a theory that kind of hangs together well. And then the other theory is kind of what I mentioned earlier is, the belief that smoking helps with your stress or distress. But we kind of know that's to do with the self treating of withdrawal symptoms. So either trying to prevent your cigarette withdrawal symptoms or treat them in the first place. And then probably the most exciting bit of research at the moment is research that colleagues down in Bristol are doing that are looking at genetic studies. So what they're doing, they're taking kind of the genes of millions and millions of people and sorting out their kind of genetic codes, and they're able to kind of with a particular type of methodology and analysis, they're able to work out what comes first in terms of, does the smoking come first or does the schizophrenia come first? And what they're finding is that smoking is increasing your risk of having schizophrenia in the first place or having depression in the first place. So that's an important area of research that I think at some point we'll be able to disentangle what's going on between smoking and severe mental illness.
That's really interesting. I'm not sure I've got that right. So tell me again, this Bristol study is finding that genetic influences which predict smoking, that when people do smoke, that then is partly a cause of subsequent severe mental illness.
Yeah.
Wow. Okay. So I didn't know that. I do remember from when I was trying to quit smoking that I would often feel like it made me feel better, that the stress went away. And actually, sometimes when I was really depressed, it felt like, I was treating myself the way I deserved to be treated, which wasn't very well. So obviously not a great mindset. Vaping though, right? So if quitting smoking and nicotine use improves your mental health, with vaping you're not necessarily quitting nicotine, are you? So does switching to vaping, is that still a good thing for your mental health?
I think it's a good thing for your mental health, because what you haven't got is those thousands and thousands of other toxic chemicals that you take into your body when you're smoking. When you're vaping, you're not using any tobacco, you're not burning anything. So a lot of the harm from tobacco cigarettes is coming from that combustion. So what you're not getting is all those other physical health problems. If you're not getting all those lots of those physical health problems, that's going to have an effect on your mental health. But what you're not then experiencing is those really uncomfortable withdrawal symptoms, because you're not losing that nicotine. So so if your mental health is kind of effectively staying stable because you're not having that big drop from your nicotine, that's also going to be much more physically and psychologically comfortable for people.
So that's really interesting. That's another argument about making sure you're getting enough nicotine to make sure that you're not constantly tripping into withdrawal.
Yeah.
Right.
And I also, you said something important earlier about kind of when you're depressed and you're kind of smoking, you feel that you're treating yourself in the way that you deserve to be treated. And I think, again, when, if you've got kind of existing mental health problems and you're trying to give up smoking, and and you're not able to do that, there's a sense of shame that sometimes comes with that, and a sense of failure. And so what you don't want to do is be constantly putting in yourself in that situation where you feel like you're failing. When you do manage to stop smoking, and a lot of people with mental health problems manage to stop smoking, the achievement that you get from that is often a springboard for going on to trying other things that feel like a mountain at the time. But if you manage to stop smoking, then a lot of the people that we work with, they say things like, well, if I can stop smoking, I can achieve anything. And it's a springboard for other kind of behaviour change and making some positive changes in your life.
Look, I hope I wasn't oversharing there, Debbie, because obviously, civil servants with big white beards aren't supposed to admit to having bad feelings about stress and stuff. But yeah, quitting smoking was a big achievement for me too.
Mental health doesn't discriminate between people. We all have mental health challenges.
Yeah, we do, absolutely. If I've got this right, then, you have told me that although it might feel like smoking is relieving your stress, in fact, it's partly causing that stress, because what you're doing is you're relieving your nicotine withdrawal. So you feel better in the short term, but actually in the longer term, it's quitting smoking completely that actually improves your mental health. The vaping can be a way of doing that, but you need to make sure that you're getting enough nicotine so that you're not constantly in that terrible state of withdrawal where you're kind of always thinking about it.
Yeah.
And then there was this other really interesting thing that I had not known until today, which was that there's new research from Bristol, because I knew about their stuff on genetics, but that's suggesting that actually smoking might even be a cause of severe mental illness. Have I got that right? Is that all pretty much?
Yeah, you have. Yeah, absolutely.
Okay, Debbie, true or false? People with mental health problems need to smoke as a way of dealing with the stress.
That's absolutely false, Martin.
Debbie, thank you very much.